But first, to any close Canberra watcher, it would have been obvious that the Victorian aged care crisis was deepening as soon as the Prime Minister cancelled his 3-day working visit to Queensland and returned to Canberra. Even in these times, Prime Ministers don't lightly change their plans. With aged care facilities now making up 46 out of 72 pandemic deaths in Victoria's second wave, and with more than 800 current cases from more than 80 residential homes, this crisis is well and truly escalating. And with Victoria's shambolic mishandling of hotel quarantine most likely the start for this entire second wave outbreak, and with Victoria's understaffed tracing system totally overwhelmed, it was inevitable that Premier Daniel Andrews would try and turn the aged care blame game onto someone else. After all, it was irresponsible family gatherings, according to Andrews, that were initially to blame for community spread. Then all the young people, he said, who were failing to obey the rules. Then the people who'd been tested but who weren't socially distancing while they waited for their tests. So naturally, all of this latest disaster, has to be someone else's fault, in this case, the federal government. Even though nothing like we're seeing in aged care homes in Victoria have happened on this scale in any other state. It's not about blame, he said yesterday. It's really not. Before going on to do just that and to blame it on the federal government, given that aged care facilities are federally funded and federally regulated.
My mother is in her mid-70s. She has some underlying health issues, but she lives at home. Some of the stories we've seen are unacceptable. I would not let my mum be in some of these places. So nursing homes, a Commonwealth responsibility? Well, up to a point, yes, they are, but the overall health system is still, under our Constitution, an area of state control. So let's have a little bit of context and some history. A few decades back, with life expectancy under 70 years of age, nursing homes as we know it barely existed. There were a few state-run convalescent homes for people leaving hospital who couldn't go home, and a few private centres for very old people who could afford to pay for nursing care. But by and large, if you lived to a good age, you were generally living with family. So there wasn't an aged care sector as we know it today. As more and more people started to live well into their 80s and 90s, churches and other charities then started to establish aged care homes. And with the beginning of the Menzies government back in 1962 or thereabouts, the federal government subsidised these homes as the cost of care started to exceed the value of people's pensions. As things stand, nursing homes are full of people who are either frail or sick or both, but they're not hospitals. And when people in nursing homes fall seriously ill, a proper hospital is what they need and deserve, given they've paid taxes all their lives, just as is the case with everyone else. Even though all the experience from here and overseas showed that people in aged care were by far the most vulnerable to this pandemic, no plan seems to have been worked out for the management of corona cases between nursing homes and the Victorian public hospital system. Even though it should have been obvious to any half-competent health official that many nursing homes, however well-run they might be, that they didn't have the facilities for large-scale isolation and that significant numbers of nursing home patients would at some time be needed to be transferred at hospital, we didn't see a plan. We know, for example, in a number of these homes, bathrooms are shared, as are other facilities like the dining room, meaning infection management would have been nigh on impossible once you get 1 or 2 cases in the facilities. So the initial failure to move people out of these aged care homes, because to move them, the Victorian government needed to open up room in Victorian hospitals, followed then that the panicked move of residents and their families being kept in the dark suggests that there was no real plan, that the Victorian system failed to anticipate and prepare for what could easily, or should have been, foreseen. And this is the basic task of government, isn't it? To work out what problems we're likely to face and then be prepared for them when they come. And that's where
has been this failure again in Victoria. Now, I accept that many nursing home patients and their families don't want heroic interventions just to keep them alive, come what may. But that must never mean that we fail to take elementary precautions to keep people as safe as we reasonably can. In a decent society, people should never become dispensable just because they're old. So here's a challenge for you, Premier. If you really think that the aged care crisis in Victoria is all the federal government's fault, I want you to invite the Prime Minister to appoint an aged care supremo for Victoria. Instruct your public hospital officials to prepare immediately 1,000 isolation beds in hospital wards for aged care patients with this virus. And let's have someone in charge actually taking responsibility for this crisis, actually being accountable. As things stand due again to the incompetence we've seen over the past few months, we're about to see dozens, maybe hundreds more deaths, while two levels of government trade barbs and try and shift blame. I can't think of anything more callous, avoidable, or pointless.